Hi everyone, in this video I am going to present a topic on infarction. Okay, infarction means tissue death, or we can say that is a necrosis. Okay, it mainly occurs if there is any decreased or complete cessation of blood flow to the particular tissue or organ. Okay, there are two main types: white infarction. This one is mainly occur in kidney or spleen. Okay, because the tissue in that kidney and all very fibrous in nature. The lack of blood flow will leads to coagulative necrosis, okay, which result in the white and opaque appearance of the affected tissue. Okay, then another type is red infarction. This is commonly seen in lungs and intestine, where the tissue is more spongy in nature and greater blood supply will be there. Okay, if there is any blockage in the blood flow, it will leads to hemorrhagic necrosis or bleeding within the affected tissue. Okay, this one will result in red appearance. It is mainly occurs in atherosclerosis. Atherosclerosis in the sense it is a condition where the artery become narrowed due to the buildup of plaque. This can also lead to reduced blood flow or total blockage, which will cut off the oxygen and nutrient supply to the affected tissue or organ. Okay, infarction also occurs due to thrombosis, embolism, vasculitis, or other direct compression of blood vessel. Okay, the next concept is shock. Shock is a medical emergency state if a person's body is unable to maintain the adequate blood flow to the vital organ or vital function. Okay, without prompt intervention, the shock will lead to multiple organ failure and death. Shock can be caused by severe bleeding, heart failure, and other infections. Okay, there are different types of shocks. The first type is hypovolemic shock, which occurs when a person loses a significant amount of blood or body fluid due to the injury or burn or dehydration. Okay, then second type is cardiogenic shock. It occurs when heart is unable to pump enough blood to meet the body's need. Okay, this is mainly occurs in heart attack, heart failure, and arrhythmias. Okay, then third type is septic shock. It will occur if there is any severe infection. Okay, that will releases toxins that will damage the blood vessels and reduce blood flow. Okay, in case of hypovolemic shock, the loss of blood or fluid will lead to decrease in blood volume. So it will reduces the pressure in blood vessel and there is a decreased blood flow to the particular organ. Okay, in case of cardiogenic shock, the heart was having inability to pump the blood and it will leads to drop in blood pressure and decrease in blood flow to the organ. Okay, in case of septic shock, an infection will causes the release of toxins and damage to the blood vessel and leading to decreased blood flow to the organ. Okay, the body's response to the shock will result in domino effect, that will leads to a chain of events that worsen the condition. Okay, the decreased blood flow to the vital organs such as brain, heart and kidney will causes a malfunction of that particular organ. Then it will causes heart attack, kidney failure, brain damage. Okay, the shock is a severe medical emergency that will require prompt medical attention. Okay, this type of shock and its cause should be determined to provide appropriate treatment. Okay, the treatment may include IV fluids, blood transfusions, medication and surgery. Okay, thank you for listening.